Hi, everybody. Hi, Crystal. Hello, Janet. Hello, Melissa. Nice to see you guys here. Yeah, I got a new inspiration today from. I was having a conversation with a friend of mine who is a big deal on LinkedIn, and I am friends with him. So we were having a Zoom meeting about something. And he told me that he's also a trumpet player, and he needed real good training on breathing. And so I ended up telling him some things about the breathing, the pranayama, the extending life through deep breathing. That's what pranayama is, right? So we were talking about that, and then I thought I'll do a master class on that because it's such an important health thing and wellness thing related with your rapid thinking, anxiety, and anaerobic metabolism, and reviving a lot of clarity in your mind. So many things are connected with breathing. And if you look at it, many people breathe very shallow. And we are not even aware of it that they are breathing shallow. They think breathing will happen, that's okay. But yeah, that does, but they doesn't get the conscious deep breathing. Okay. So I thought I will do the master class. So I was working on that. So I'm giving a heads up notice. I will do that probably this coming Saturday, right? And excuse me. So you can sign up and come and participate and learn all the intricacies of the deep breathing and the advantages of. So I'll go pretty deep in that, in that way. So if you want to come up and ask me any questions, that will be fine here. But otherwise, this breathing is so important. Uh, we see the other way. People who smoke, they will be losing the breathing slowly, and they have this chronic obstructive lung disease, pulmonary disease. That's a COPD, we call it, and that is very, very much. You can see the suffering right in front of you, and they are hooked on the smoking. They cannot stop smoking. It's not only physiological but also psychological addiction, right? So as these smokers survive, but then losing the breathing capacity, and they really suffer a lot because they are not. So imagine you are not able to breathe for a few minutes, how much suffering you have. And these people go through the whole day like that because their suffering level, their breathing level capacity has gone down, but they are still surviving, but they're fighting for the breath all the time. Their own making, but still we have to help them, right? So I have seen those people till they die, they're aware of their suffering. That's the problem with pro smoking and breathing. And also the pollution of the air, that is not helping very much. And also people are not used to the deep breathing, and they don't develop that enough lung capacity that you need to have a vital existence too. So vitality is very much related with your deep breathing. Anyway, I was going to tell them in the master class, um, I'll go deep into what is the modern understanding, what is the ancient understanding of the breath, and I'll probably demonstrate some different types of breathings, and then take time to make sure people are getting it and then they're doing it. And if you do the way I tell you, and then you continue to practice, you will improve your respiratory capacity for sure, but also you feel relaxed, and also you will mind will become easier, right? So that's a very good thing. um, so come up and ask me anything if you want to ask me questions regarding that. But this is just to announce I'm planning this. What do you think? What do you think, Janet? What do you think, Melissa? Come up and tell me, or bless me with your approval that you think this is a good thing. Then I'm going to give my. I actually found myself very much benefited by the deep breathing. See, I was doing physical yoga to begin with, right? And when I really got into the breathing and then really understood from BK Iyengar what is the deep breathing, how he does, and how to incorporate into a regular routine, that has changed significantly the way I felt about the energy I felt, the clarity I felt in my mind, and also the deep sleep that I was able to, experience. Everything improved. The physiology and my mind going all over has stopped, and then my energy has really quadrupled, right? So I nobody need to tell me how good the deep breathing was, and I kind of incorporated into my regular routine of exercise. And later on, I discovered the runners get a lot of benefit by really making their breathing efficient, right? So I learned about that, and then I'm teaching the runners all the time. Athletes, whatever game they are playing, if they can master this deep breathing, they were able to improve their capacity quite a bit. That was there too. And also, the women who are pregnant are going to go through the labor, and once they learn the deep breathing, they were able to have easier labor compared to people who don't know about it. Okay, and then the mountain climbers, that's a very important thing because you got to acclimatize to the weather, right? As you climbing the mountain and all that. So that's a very good tool. So variety of people that I kind of worked with and helped them and gave them suggestions about even runners, simple runners, how I helped them to have longer expiration than inhalation. That helped them a lot. So it's a very important topic, and if you have any uh, experiences or how you feel about them, you can come up and tell me, or you can send me DMs about if you want to. You are doing such, like for example, you're a singer, and how can you have one of these measures that I'm going to show, how that helps your secretions of the throat going down. You have more clarity of the throat, and you can pronounce words and symbols and noises much better. Okay, so any number of starting from physical health, improving the oxidative respiration, and metabolism is improved because you have more oxygen going into your blood than otherwise. Okay? Shallow breathers doesn't have that kind of thing. The cramps, the lactic acidosis accumulation, everything goes down. So by making your breathing efficient, you will make your aerobic metabolism much better. Okay, think about that. So if you have any questions or any concerns, you can always get me that. But then this Saturday in the morning, 9 a.m., I do the webinars, right? This is going to be a master class for the breathing. Okay. Okay, Melissa is coming up. Good, I'm glad that she's coming up. Okay.
Hi, Dr. Rao. How are you?
I am great, Melissa. How are you?
I'm doing very well. Thank you for asking. I wanted to know how could we sign up for the master class?
Yeah, it's a the sign up is very simple. One flyer. I already have the flyer. I have to release it, and see that in my profile and sign up there. That's it. And there are certain instructions I wanted to give in that because I want them to be comfortable and while they're doing it, what they could do, especially here we are going through a heat wave, right? So you got to prepare yourself a little bit. So a lot of people lose a lot of water with the breathing. So you got to be hydrated, and you got to have a loose clothing, and also you should be in a room temperature area. And if you have a mat, yoga mat, that's better, or you can sit in a chair and do them too. Simple instructions. Some of them I'm going to. Okay.
Okay, that sounds wonderful. I think that breathing is
Yeah,
so important, and having asthma, it makes it a struggle for me. So
yeah,
any tips, like, and you also mentioned singing, and I love to
yeah.
sing, and any tips I think that could help me with those, that would be
Yeah, asthma.
amazing.
I think you will be very thankful to me after I tell you what I tell you. But the thing is, you got to do what I tell you and then experience for yourself how better you feel. Okay?
I'm already very thankful for you, Dr. Rao. I don't know how I could be more thankful, but I guess I'll have to
No.
attend the class on Saturday and
See,
see.
I have seen so many asthmatics in my life, Melissa. From the childhood, we see them, right? And these asthmatics, they suffer a lot because they can't breathe sometimes, until they get the inhaler, till they get some liquid through their breathing treatments. They feel very tight in their stomach, chest, and also they have got these secretions that get kind of insuffated. That means they get uh, more like a solidified, and that's why you have to give them a lot of fluid and you have to make that all loose and come out. This breathing exercise, they're special for the asthmatics. We show them, and they are, as it everything, you cannot build muscle in a day. You got to do it regularly for several weeks, right? Like that. This also can be done progressively. You improve. You feel better and better as you get the knack of it. So the shallowness of the breath can be corrected by practicing every day deeper breath. So you learn the techniques and then you incorporate them into your daily routine and do that all the time. Okay, i I kind of recommend for asthmatics a session of 15 minutes in the morning and it's 15 minutes in the evening, and in between 2 or 3 times practicing deep breath or pulsed breath. People know a lot of different ways. Whatever they are convenient, comfortable, they can do that several times a day. Then that becomes actually we have the time, we have the occasions too, but we don't think that's important. That's why incorporating this routine into daily routines are very important. Okay.
No, I know it's important.
Yeah.
Just that simple trick that you told me with taking the deep breaths in the morning and reminding myself that I'm not my thoughts and I'm not my body. I mean,
Yeah.
that's been a game changer for me. So that's why I definitely am interested in your master class. And I
Yeah.
just wanted to make sure I don't miss out on the opportunity,
Yeah.
Dr. Rao. Thank you.
This is going to be pretty routine for people and also pretty in depth for people who are already doing them. So obviously, I'm going to focus on why it's so important and then what are the things that you could do, anybody can do. I will start with a very simple one, but then as I'm advancing to reach advanced practices, people may not be able to do that day, but then keep the recording and then do it daily like that, and then you will be very, very energetic, very clear in your mind, and also really having this inner metabolic energy which burns away your calories.
Oh, well, I like burning away calories. So that
I
sounds
know,
wonderful.
I know. I'm mentioning that too because we all want to. You are not the only one, Melissa. Everybody wants to burn the calories and really have the good calories, not like anything else. Yeah, yeah. I think Melissa will enjoy that, especially if you have a kind of asthma or COPD. What happens is the bronchioles go into a spasm, and that's why they feel like a chest weight, chest tightness, and that discomfort of pain and all that. And also their mucus gets dehydrated and gets they call plugs of Lanac. So they are mucus plugs. They usually get very hard for them to get them out. That's why these days we have inhalation of normosaline, inhalation of dilating medical stuff and all that. There's everybody knows the treatments, the Proventil treatment, albuterol treatment, and all that. And we give them to help them to ease all the tightness, all that spasm and also lack of air and also the mucus and all that. Okay, quality of life will be much better if you incorporate deep breathing. Okay, that's why I'm going to put a lot of energy into this because I know how important it is for people to feel better with breathing. And I myself, I feel so much better when I do the exercises with coordination with the breathing. So I talk about three B's, aligning three B's in the morning: body, breath, and the brain. All these things are really aligned, then you feel so much better. So I'm really excited about this because it's going to do so much good for so many people: smokers, heart failure patients, or chronic pain patients, or people who are having a lot of anxiety and disturbance in the mind. All of these people can be benefited to some degree or the very, very much according to how sincerely they perform every day these exercises. I'm going to demonstrate to them, and I'm going to demonstrate 10 varieties. And first time maybe you may not be too exactly. That's why keep the recording and then use that daily so that your breathing will be improved. Okay. Anybody else has any questions or anything that you want to know about it? Peter, come up. Janet, come up and talk to me and bless me about this program so that I can do it better. Okay. See, whenever I have a subject and I see the potential of its improving or improving the quality of life of people, I get super excited. So, because I see so much of suffering, right, in the patients and the people who seek my advice and all that. I always feel like, "Oh, if only you have seen me earlier, you would not have avoided all this suffering." But I can say that to them. That looks kind of mean, right? But I feel that. If only they had seen me earlier, or somebody else who is telling them like this, they would have avoided a lot of suffering. A lot of our modern life is like that, unnecessary suffering, and then also not really reaching out the solutions that were practiced for centuries, thousands of years ago. And also putting on this rat race where you go and do stuff all the time without taking care of you. That is also not good. Okay, so whenever I have this kind of programs, I really get excited. So I don't know, something like that excites me, not about making money and all that. Maybe something wrong with me. That right, Peter?
Nothing wrong with you. I promise you.
Okay. Yeah. Well, I was so excited when I got this topic with my friend this morning. We had some business meeting about something, and we ended up talking about him playing trumpet. And then he told me about his deep breathing. Then I showed him some things. He was very happy with that. Then I said, "Yeah, I should do this as a master class for other people." What do you think?
I think it's great. So, to full disclosure, I caught the second or caught the last 2 minutes of Melissa's talk. So I caught a little bit about the breathing, but I don't know exactly
Yeah.
what you're doing on Saturday.
Yeah, this is a master class on deep breathing, especially pranayama, because I want to show people why we are shallow breathing. Most of the time, people are do that because they don't
Yeah.
consciously do it, so the
Yeah.
unconsciously it will be shallow. Okay,
Yeah.
so I will show them how they can observe that they are breathing shallow or deep, and then how they can make their volitional conscious breathing, which is going to be deep. And also,
Yeah.
what is the posture, and also I will tell some medical terms of what we measure and what we can look for, and how you can test yourself, how your breathing is. And then
Nice.
yeah, and then don't get panicky about it, but then know that there are solutions. So no matter what your problem is, if you have myasthenia gravis, that's a problem. Okay, respiratory muscle paralysis, there are serious nervous disorders that are pretty harsh on the breathing.
Sure.
So knowing, I think knowing this fundamental thing and how to do it on a regular basis, and also recruit it as though it is going to improve our nervous energy, our thoughts, our energy at the cellular level and also really repair a lot of problems that we have. I'm going to
Yeah.
enumerate all that. So it's a kind
Yeah.
of blessing to know as a modern physician the physiology of the respiration, but also what are the things that I can do. I don't require anybody. I can do that will improve my quality of life with the
Right.
breathing only, nothing else. Don't have to
Yeah.
worry about the philosophy or anything. There is a saying in Hindi, Peter. They say, "Abhi karo, abhi pao." Abhi means now. Karo means do. Now, do it now, and then get the benefits now.
Uh, yeah.
That's what I want
Yeah.
to get it on Saturday. Do that with me and see a little bit improvement in your
Right.
mood, in your thoughts, in your energy, in
Right.
your clarity of mind. All those things will happen. You'll notice yourself,
Yeah.
But integrate into your regular life depends on you, then you will get it.
Yeah.
And also, special word about like Melissa mentioned, heart failure people, and also neurodegenerative. That means all the neurological disorders that can be affected, and these people are born like this. So
Mm,
they
yeah.
they will
Yeah.
have to fight every day, Peter. Really,
Yeah.
every day they have to fight. So
Yeah.
it's a courageous thing to teach them, and then for them to do that is really every day they feel like they're drowning, and then we are kind of picking them up.
Right.
Imagine that you are drowning, and then you are taken out of the water.
It's a
So
beautiful feeling. I
yeah,
remember. My mother had COPD. Of course, she
Yeah.
passed, but I
Yeah.
remember like putting her through the paces of some breathing exercises and
Yeah.
an occupational therapy or
yeah,
physical therapy. I said, no, you have to do these with her as well.
yeah.
So it really increased her quality of life, and she
Yeah.
felt better.
It does. It does.
And it just really helped her out. But I love doing it, and as you
Yeah.
know, I told you the other day, like
Yeah.
it really works for me
Yeah.
when I'm listening now. When I'm actively listening
the
to someone, I
C-
take that moment to
the
breathe.
COPDers, they suffer that lack of breath till they die.
Yeah.
Because their brain is not unconscious. They're conscious. They know about it. So that's why my heart went out to those people who have COPD and
Right.
they regret they smoked that long, and then they
Yeah.
kind of punish themselves that way too. But the
Yeah.
important thing is physically they suffer.
Mm.
So we have to do a lot of different things for them, but I'm going to go through some of them. I can't do everything probably, but my focus will be how can you improve your quality of life just by understanding what is deep breathing, how it can be incorporated into our daily life, and how to really walk, breathe well. And if you have something like you have eaten too much and then you cannot really digest it, walk and breathe and see how it does. Suppose you do the breathing exercise before you have an athletics performance, like a football player, basketball, whatever. See how much it's like training yourself going into high altitudes. Then you have to train your lungs better before you attempt to be there, mountain climbing and all that. Even in the airplane travel, you got to improve your breath beforehand and see how little exhaustion you have as you go through that. That's all there. So I kind of um, feel the people who are traveling with me on the plane, and I feel great, and then they feel miserable. Then I have to tell them some things. There's I can only tell a couple of people. I can get up and announce that in the plane, but some planes have incorporated physical exercises for the travelers.
I think that's great.
Yeah,
I think that's great.
but not the deep breathing like I was talking about.
Hmm. Yeah.
For
I think
example,
people might be a little bit
take
afraid
this.
still to breathe deeply in an
Now I will
airplane.
do that Abhi Karo Abhi Pao with you right now. 1 minute, okay? All,
Okay.
all I want to do is count as you breathe in. 1, 2, 3, 4, 5, 6, 8. And hold this now. 1, 2, 3, 4, 5, 6. Now breathe out. 1, 2, 3, 4, 5, 6, 7, 8. That's it. You do this holding in between while you are
Right.
breathing in, while breathing
Right.
out, and see
English
how.
vitals.
Mhm.
It's so enjoyable too. I mean, I love doing it. It's just like when I got on with you, I said, "Oh crap, I haven't done any deep breathing this afternoon." So I said, "Let me take this moment while Dr. Rouse explained this." And I'm listening to you, and I'm breathing. My mood is elevated already because I really enjoy it. It's very enjoyable.
Yeah.
Very enjoyable.
That is what happens once you get, you have built up some capacity with your
Yeah.
breathing. That's why it doesn't seem like a punishment.
It's fun.
Yeah,
I love
because
it.
you are extending your capacity a little bit more. That's why you enjoy it, you know. That's why this is also a type of breathing things I was going to tell people, and also maybe explain respiratory physiology in a modern sense. What is the tidal volume? What is the residual volume? How does this Sanskrit terms for that? You know, that way it will be fun for them to expose them to something new that they never heard about. You know.
Do you know what I really love? I really love, depending on what type of breathing you're doing, I really love, after inhaling, holding it during that period, and then some exercises after you exhale, you'll hold it for a certain amount of time. I really love that space in between there. I mean, I just become so present, and I don't know. I really do enjoy it.
No, that is that you see there in Sanskrit there are three terms. Okay? One of the terms is kumbhaka. When you hold the breath like that, that is that almost nobody knows, Peter. That is why you have to do that and experience that silence.
It's beautiful.
Yeah. And also it does increase the capacity of the inhalation, exhalation, because you are holding it. Actually, there's a lot of deeper meaning in there, but then basically you are holding that, but it means you are reducing the number of times you are breathing, and you are saving, you are banking those breaths. That's why your lifespan is increased. Yeah, that's what happens. I'm glad you took it up and then you're doing it. And the other thing is, you and me, even though I have been practiced for years, we still have ways to go by. Improvement, room for improvement. So that is why you feel so good when you extended that capacity.
Yeah. It's really neat, and it doesn't cost any money to breathe.
No.
We're doing it all the time anyway.
Actually, you'll save probably you'll save because you don't have the metabolic illness. You know. You remember I was telling about AMA, which is waste products Ayurveda talks about. You know, like we call in English toxins, right? Or waste products from the cell. They are complete. This AMA, some of it is retained because of your shallow breathing.
Yeah, you're not expelling it.
Yeah, when you are expelling from bottom and then it all coming up. See, in the smokers, for example, they have the cilia in the trachea, right? And the tubes, respiratory tubes in the lung, and they have small cilia. And those cilia, they kind of do the scavenger function. They get all the gunk out through the mouth and through the glottis and all that. But when you smoke, those cilia don't work. That's why they retain more gunk in the lower part of the lungs, and they give rise to smoking bronchitis and pneumonias. So as simple as that. Once you understand that, you start to breathe deeply out, you get it out. It's a very simple thing, Peter. But then once you are doing it, and then you'll also other thing I think related to you, what you do, your work, the pain perception. You know, the pain perception and also threshold goes up, perception goes down. So you may have an area that is cut and that is paining, but then the perception of the pain goes down so that your taking capacity of the pain increases. So chronic pain people that I deal with the deep breathing for them, and also explain to them how that whole mechanism works. The more they experience the relief of that, the more they love it, and then they'll be doing that because they have direct evidence that I don't rush and take the more medication just because I have the pain. I can have the pain. Pain is a reality, but suffering is not. So pain is reality, but the suffering is optional. It's not that we're saying, oh, you just imagine. That's cruel. But you can improve the capacity for people to really increase the threshold of the pain. So the pain, it comes in, doesn't bother you right away. It has to be a lot of pain before it begins to dawn on you that I want to relieve something. But otherwise, you won't have this knee jerk reflex of taking medication. That will go down. And as you know, operator, that is a good service for anybody who was on pain medications at one time and how they are tempted to take more and more of it, which is not good. So that way also, I helped a lot of cancer patients to cut down on the narcotics. And they are a lot of pain, but then they could, the sleep cycle is disturbed because of the narcotics, and that is also a problem for them. But when you made them realize this, they started to do deep breathe much better. And some of them really improved their quality of life because of that too. So it's not like I'm singing praise of holy because I'm prejudiced also. No, it is something I have seen with my patients. Let that be cancer patient, let that be asthma and COPD and other musculoskeletal disorders, and let there be obese people. So many anxious people, especially young kids, they don't have any control of this. These days, they are introducing them to instant measures, promising you will get all the relief with this. But actually, it is not so. It's not so at all. The instant gratification actually decreases your pain threshold, and then you will be needing more. Yeah, Peter.
I was talking, I didn't realize
Mm.
was I timed out. But yeah, so no, just wanted to really know. I want to thank you, of course, for coming up and having this talk because it's helped me already, like while you were talking. But also Saturday, what time?
9 o'clock, our regular webinar time. That's this today. This week's topic is this master class of the breathing.
Okay, great.
Yeah.
Thank you.
Yeah,
Namaste, Dr. Rao.
Yeah,
Thank you.
sure, sure. So it's a question of sharing ongoing journey for me. And actually, that person who talked to me, he's a trumpet player. And my son is also a trumpet player. And my son does a lot of breathing thing too. So I told him that, and he also showed me how the breathing. Then I gave him some pointers about the deep breathing and all that. And he said, "Oh, that would be great. I'll try that." And all. So it's like I said, if I find some cause that I could improve without medications, without money and all that, if I could give some insights into our regular normal things that we could do as human beings, and they are not doing it, that is a unnecessary suffering in my dictionary. So we could learn, we could improve our quality. We can be intelligent that way, right? So I hope to see you all on Saturday and come at 9 o'clock. And it will be on the Zoom and also other channels too, so that people can come in and do exercises with me, so that way you all can see that. Okay. Janet, come up. I want to say a word with you so that unless you are not able to come up, Janet is somebody who stays in the bed and does all the yoga routine. But what I want to tell her is this one, I want her to sit in the chair, with the spine erect, so they get more out of the. A lot of elderly people cannot get out of the bed or sometimes and cannot do the exercise also. That's okay. But then for the breathing part of it, I would like them to be in the chair as much as possible, not to lean in the back support and keep the spine erect, and then do these exercises as though you are sucking air from the level of umbilicus, and then just deeply taking a deep breath so that abdominal wall raises. And as you breathe out, make sure the abdominal wall goes. For example, there is this Om, which is a primordial sound in that culture. So that is very much revered. It has got a lot of meanings. It has three words. One is about wakefulness during the day, and then dreams, and then deep sleep. So they call it as a Jagrit state, that is wakefulness, Swapna, which is the dream state, and Sushupti is the deep sleep state, right? So beyond all this, there is the silence. That's the fourth state. It's called Turiya. Once you end up the Turiya and carry that kind of deep sleep with your awareness, then you bring it during the day by understanding deep breath in, deep breath out. That's good. But in between, that is the holding the breath. And that is where the silence is. So if you understand the intricacies of the Om, intricacies are connected with your awareness, you will be breathing much more naturally, much more deeper. And you will feel the energy right away. For example, I have a meeting, for example, I go there, a lot of demands on me talking about a topic, or lecturing on a topic, or questions and answers, answering a topic. There's so many challenges will come to my mind, right? If I allow the mind only function, chattering away, not taking the breath to bring my awareness to the present moment, then I'll be exhausted. At the end of the talk, I'll have the brain fog and all that. On the other hand, if I am really want to answer the questions, but in between I take a small break, very few seconds, where I'm breathing deeper, I'm holding it, and also then all that I talked up until then, all the junk that is accumulating in my mind without me knowing anything about it, that is called ama in Ayurveda. Cleaning that up as it accumulates is the art that you learn. Anybody can do that. And then what happens is, moment to moment, you become much more alert, aware. So that's a beautiful state to be in, beautiful energy to be in. I don't know whether this makes sense for you guys. If you have any doubts or thoughts on that, come up and tell me about it. Otherwise, experience that. Take a deep breath in, hold it for a few seconds, and then breathe it out and see how you feel. The key is holding the breath for a few seconds and making the breath go all the way deeper. In physiological medical terms, what happens is the respiratory unity we call alveolar surface, right? That's where the gas is exchanged between outer air, the carbon dioxide given to it, and oxygen is taken from it into the inner venules and all. So the more you have deep breath, the more possibility of having more oxygen into your system and getting the carbon dioxide out. Thereby, you're more efficient about metabolic needs, metabolic processes. And that's why you have more aerobic circulation, more generation of energy, and less of the toxins in the system, and they will go out. Okay, I hope that makes sense. But I'm going to be more detailed about all these things in a scientific, modern, pulmonologist way that you could understand. If you have regular breathing, no problems, that's fine. But if you have pollution, how do you improve your breath in the presence of pollution? Suppose you have a illness, asthma, COPD, heart failure, any number of things that affect your respiratory, cystic fibrosis, so many things we treat, right? And how, or even a farmer's lung, or silicosis. So many conditions they are coming to me because I will treat them all the time. How do you understand that these people can really improve their efficiency of the lungs, and also even if you understand, you have two nostrils, right? Left nostril, right nostril. Do you think both of them are open all the time equally? No. Normally, also, one nostril will be dominant for 90 minutes to something like a 30 minutes, like that, So you will be having more air going through the left for some time, and during that time, the solution, the kind of the solid swelling of the right happens inward, so that you are really not having complete passage of the right nostril forever. And then that goes down, goes to the left side 45 minutes to 90 minutes later, depends upon the person. But any given time, many people don't have both nostrils equally open. That's a physiological thing, not that you are diseased or anything like that. But that's not irreversible. That's not that you could work to open it up. So the alternate nostril breathing that we do, it does that. It opens both the nostrils equally, so that more air going in through you and more air coming through you, because of the that so-called physiological obstruction of the nostril will be going down. Okay, so that those kind of, this is a very simple understanding knowledge thing. Once you know about it and then do this alternate nostril breathing, even if you do the shallow breathing, your breathing is much better. Naturally, right? If there's less obstruction, more fluid will go through in a river, right? Like that. If there is less obstruction in the nostrils, you will have more air going into you and coming out of you. Okay. So remember that. So I'm very excited about this topic. This is such a fundamental, easy to apply, and immediately seeing the results. Okay, so very important topic. I hope you all come and take advantage of that. Okay, any questions you have before the meeting, submit to me in my DM, and I'll be happy to incorporate answers into the talk. Okay, or you can ask me at the talk also. Okay. Anybody else has any questions, any doubts before I hang up here today? All right, then I'm excited. I'm going to go and prepare all those flyers and all the important topics and all that, and also I'll introduce you new way of pranayama exercises. I do 10 to 12 and 15 according to the time I have. So usually it depends upon the questions, it depends on diseases. Hi, Ronald.
How do you breathe differently during sleep than you do during when you're awake?
Okay, during sleep, it depends upon how your upper airway is. Okay, suppose you have a thick tongue and you can fall back and then close it partially, or or open up occasionally, but again close it up. So the snoring and the people who are really obese have this difficult breathing. The air is not going enough inside, and suddenly the carbon dioxide builds up, and suddenly they wake up and come out. But if you are really having a normal upper airway tissues, you breathe normally. You don't have to snore. The upper airway obstruction is not there. So uh, but you are unconsciously breathing. When you are breathing, it's necessarily not that depth as you are while you're awake. You are conscious, right? Then you could do that. That's a good question, because in the sleep also you have the awareness that doesn't go anywhere, but you are not awake and you are not really conscious in the sense that you could do conscious deep breathing. So when you are deep breathing outward that can be a habit and go into the sleep routines, and then you can breathe there also. But you cannot do consciously there. Basically, you are unconscious, you are sleeping. That's a good question, Ron. This is important because while sleeping, a lot of people are agitated for a long time. And the dream state happens longer in people who are kind of thinking all the time, don't have any rest for the mind and all that. But if you are attentive to whatever you do while you are awake, then you will have less dream. That means more of deep sleep. In the deep sleep, you will be breathing, but you'll be breathing in a rhythm. You will not be breathing in staccato because you don't have any obstruction to the airway and you don't have any conscious drive going on. Okay, but if you have shallow breathing, you progressively have more carbon dioxide, and that's why you go into what is called apnea, where you stop breathing. That's the danger with sleep apnea syndrome. Okay, there's a lot of obese people, a lot of people who have thick tongue, and they have this obstruction, and that's why they breathe very very shallow, and they stop breathing also. That's what we discover when do a sleep study, how many times you stop breathing. Okay, so practice conscious breathing while you are awake. Okay, all right. So anything else? Anybody else has any questions? Okay. All right, then with that, I will be taking leave for now, and look for my talk on Saturday, 9 a.m. Central on Zoom, and also all the other channels like I normally do. Okay, thank you. Bye bye.
Dealt with pain or you're really